We're here today about the heartbreaking death of Patrick James. It's so sorrowful about he and what happened to him, and obviously for his wife and his family, for his friends, for the fellow residents at the Masonic Retirement Center. I contacted both last night and this morning both the White House as well as the Vice President's office. They were deeply saddened and concerned about it and wanted to make sure that I conveyed their concern, but also their commitment to provide support to help Arlington and Tarrant County and the state of Texas be able to respond to this tragedy. In doing so, I also talked with all of the top federal health officials who are in charge of the COVID-19 response. I talked to Dr. Kadlik of the Federal Health and Human Services. He is basically in charge of the emergency response to COVID-19. I talked to Dr. Giroux, who is the doctor in charge of the federal healthcare providers. I talked to both CDC officials as well as officials who have been involved in the response to a situation that took place in Washington State, which some people may draw as parallels, but it's really different than what has happened here in Arlington. All of these federal officials offered their full support as well as resources. And they outlined for me what needed to be done and the resources that are needed to respond to what happened at the Masonic Retirement Center. They include the strategies of testing every single person that Patrick James, his wife, have had any contact with in any recent time period. That would include everybody at the Masonic Retirement Center. Whether or not they had contact with them or not, the recommendation was to test every single person at that retirement center, as well as the healthcare providers and anybody else who may have come into any type of contact with Patrick James. They talked about the necessity of having a CDC epidemiological team be involved in this process because of the size of the operation. There is one of those teams en route as we speak. They talked about the need to increase and improve the infection control procedures at the Masonic Retirement Center. The retirement center is not the type of location that typically would have these infection control procedures in place before something like this would happen. But in the aftermath of something like this, not knowing who in that center may be exposed to COVID-19, it is essential that those infection control procedures be put into place immediately. Similarly, there must be a limitation on visitors. Now, this is something that was contained in my disaster declaration last Friday that should already be in place in facilities like this retirement center. But we do want to emphasize the mandate limiting visitors into this retirement center because you're walking into a zone that could include people who could test positive for COVID-19. Along those same lines is important, according to the CDC, to limit movement within this facility, again, because until we test everybody in this facility, no one knows who may or may not have exposure to COVID-19. And then, of course, they talked about conducting a full trace of all movement of anybody who either had any type of contact with Patrick James, with his wife, with anybody who could have any type of exposure to COVID-19, and make sure those people get tested. They understood the necessity that Arlington and Tarrant County have more testing capability. I asked them to send it immediately. When I arrived in Arlington today, we had already received 2,500 test kits to assist in this process. When we arrived at Arlington today, we'd already received these, which are the test collection kits, where the biological material is collected from the person who will use this material to then run the official test to make the determination whether or not COVID-19 does exist in a particular person. I had the opportunity to speak last night with Judge Whitley as well as Mayor Williams. And first of all, I applaud their swift and quick, decisive leadership and engagement in this. They're doing all the right things to help respond to a situation like this. Also thank their first responders, all the healthcare workers on the front line who've been involved in responding to this, who in a way heroically have put their lives on the line in trying to help those who may be exposed to COVID-19. I made clear to them last night what I have reiterated today and will be insistent upon going forward. And that is the state will partner with them and collaborate with them at the local level to the fullest extent possible. We will provide whatever type of support, whatever type of resources, whatever type of equipment, everything they need to make sure they are fully able to respond to and contain any type of exposure in this particular situation. All of us share the very same goal. We want to limit the spread of COVID-19 to other residents, and we want to limit the spread by anyone and to anyone that could be affected in this particular incident. Now, the fact of the matter is, when you consider what happened here, we must understand that Texas and Texans are living in challenging times, but Texans are always up to those challenges. We've dealt with SARS, we've dealt with H1N1, we've dealt with Ebola. We will get through this just like we got through those other infectious diseases. The family affected by this, the city of Arlington, Tarrant County, and the state of Texas, we all need to support each other. We need to show patience. We need to show collaboration of everybody in the entire community to ensure that we resolve this situation with the maximum public safety. And with that, I'm going to pass it to Judge Whitley.
Governor, I want to begin by thanking you. As you've indicated, you called both of us last evening, immediately said, whatever you need, we're going to get it there, and have pledged the full support of the state, and I really want to thank you for that. I also want to extend the condolences to the James family. What I'm going to try to do here is to outline a little bit of the process that they experienced as they went through this. Mr. James was an elderly male with underlying health conditions who lived at the Texas Masonic Retirement Center in Arlington. He and his wife lived in one of the cottages, but they did participate in activities in the cafeteria of the main facility. We have EPI teams who are currently investigating all potential contacts, both at the center as well as at the hospital. The Arlington Health Authority and the Tarrant County Public Health Authority have jointly issued control orders, which basically will allow them to interview and talk with the contacts, and then from that conversation be able to determine what the next steps may be in that particular process. You heard the governor say that they will all be tested. He was a male resident, obviously a male, who was hospitalized on Thursday, March the 12th. There was a specimen obtained on Saturday, March the 14th. He passed away early Monday, March the 16th, and the test results were obtained on Tuesday, March the 17th. This gentleman had no known travel or contacts with any other COVID-19 patient. He represented the second localized spread case of COVID-19 in Tarrant County. We currently have 9 positive cases, 2, maybe 3. We're still trying to determine on one of them whether or not it may have been local spread. This was the first death in Tarrant County. I want to applaud the Texas Masonic Retirement Home because last Wednesday, on March 11th, they actually implemented infection control procedures throughout their campus. Now with CDC's EPI team coming on board, they will sit down with them, they will review those procedures, make any recommendations of changes that might need to be made so that we can continue to do everything we can to protect the folks at the retirement center as well as other folks that the individual may have come in contact with. What I also want to tell you is that for the last several weeks we've been having regular calls in planning for what is now happening. At the current time, we are having a call every morning with our local partners, many of the agencies that are going to be involved in addressing the needs of our public as we go through this process. And those include school superintendents, they include the chambers, they include restaurants, they include a lot of different groups, Meals on Wheels, the hospitals. And each day what we ask of them is, what problems are you encountering, or what things do we need to begin preparing for? I would note that within Tarrant County we have 41 different cities that have part of their city within the county. We have 9 cities that have their own individual plans. In addition, we have the county plan. So as we've been reacting to changes on a day-to-day basis. Many of us issued the declaration of emergency last Friday, which had certain restrictions on it. We changed those on Monday based upon what had occurred and what public health's recommendations were. We've got a newscast or a press conference this afternoon at 2 o'clock where we're going to announce restrictions that we had talked about and discussed with all the cities yesterday. But based upon happenings that occurred last night and in conversations with the governor, those may very well occur. We have to get the lawyers to come together and agree on language, but those will either occur today or we may issue another set of restrictions tomorrow. So this is something that we understand is changing, and we're going to change and be able to change on a moment's notice. I would like to just again thank the governor and the folks from the state, and we're all working together. We're all working together as a team. We have a tremendous collaborative spirit in Tarrant County. I have no doubt that with the generosity that our citizens have displayed in the past, that we are going to have more volunteers than what we're going to know to do with. And we've got organizations set up to screen and to understand and to help those volunteers find things which they can do safely in the time that we are experiencing. Again, I think this is a time we're going to get through this. We have a plan. That plan will be changing. I really believe that our folks are going to pull together and that this is going to be an opportunity for us to maybe reacquaint ourselves with our neighbors and really begin to kind of make that reconnection and kind of be our neighbor's keeper. And I would encourage folks to reach out, to call the elderly, if they have older folks that they know, to reach out to them, because this is the time when we need to be positive. We're going to get through this, as the governor said. We've just got to be prepared, and we've got to do everything we can to be proactive and not reactive.
Thank you, Judge. Now, Mayor Williams.
Well, first of all, I need to thank you, Governor Abbott. Really appreciate your leadership, and what's nice is this isn't the first time we've talked. We've been working on this for weeks, and then in addition to that, I want to thank Tarrant County Judge Glen Whitley for his leadership also, especially in this difficult time. Governor, you being here today means a lot, and of course you brought resources, you brought plans, you brought an extra part of intensity to this, which we need and which our citizens are crying out for. Today, you've outlined a plan here for us here on this incident, but you have been working here throughout our state to make us safer, and we appreciate that. Before I go any further, I need to extend my thoughts and deepest prayers to the James family here in the loss. And of course, all of our residents will be doing the same. We need to keep the James family there in our hearts and our prayers. We're in a fight right now, and there's no doubt about it, and we know that we all are concerned. And I can promise you Arlington will come out of this stronger than ever. Texas will come out of it stronger than ever because we will pull together. Our kindness and our can-do spirit are just so important right now because we need to call on those qualities more than ever. We've proven our resiliency time and time again, and it's going to take each and every one of us to win this fight. And later today, our city council will meet again. We met yesterday, we'll meet later today, and as the judge said, we probably will be meeting the next day. And Governor, thank you for the ability for us to be able to do that, because normally we'd have to give 3 days notice, and now we're able to have our emergency meeting so that we can respond to the fluid nature of what we're dealing with. And while we know these measures will certainly create some hardships for our citizens and of course definitely our businesses too, I want to echo the words of our Chief Don Krausen, who's been through this many times before. We are implementing a plan with the public's health at the top. Also want to reassure you that our Office of Emergency Management and local Public Health Authority are both ready. And we're consulting, of course, constantly with Tarrant County Public Health and our local, state, and federal medical experts each day to make sure we're making smart decisions that will benefit our entire community and prevent the exposure of COVID-19 to vulnerable populations. Now, there's a lot of misinformation that's out there too, which makes it more important to rely on expert advice from our medical professionals during this pandemic. We need to not rely on the many medical professionals on Facebook right now. We need to turn to our Office of Communications, who is posting regular updates to our coronavirus website at arlingtontx.gov/coronavirus. This site offers news articles, prevention tips, information about what Arlington and Tarrant County are doing to stay up to date. The latest news, of course, from the CDC is also there and more. We've also added a list of closings on the website and outlined some of our procedural changes and closing of some of the facilities. I want to say thank you right now, too, to so many of our businesses, our churches, our schools, who voluntarily have been closing and cooperating with the restrictions that we have. It's unprecedented, the cooperation that we're seeing right now. And these are tough times that are calling for tough decisions. But it's necessary for us to make sure we put public health and safety first. And having said that, most of our city services remain unaffected, including emergency response, our garbage and recycling, water utilities, and many more. And speaking of our first responders, let's also keep them and our employees in the medical community in our thoughts and prayers as well, because they are on the front lines. They are working to help to get through this and minimize the spread of this virus. The Arlington Fire Department has published policy guidance to medical responders in the field, and 911 dispatchers are pre-screening callers to identify potential emerging infectious disease patients. Our fire department has managed infectious diseases over the years as part of their responsibility to the community. They have done it with other major outbreaks. They are prepared and they are up to the task. While there's still a lot we don't know about coronavirus, our first responders have been there through these situations before. And I plead with our residents to practice smart hygiene habits in the weeks and months ahead. I mentioned a fight. This is a different kind of fight. We are fighting against old habits. We've got to not be shaking hands. We've got to stay at home if you're sick. Don't try to fight through it. We also need to wash our hands. We also need to avoid touching our eyes and mouth with unwashed hands, and please remember to wash your hands and routinely disinfect touched objects and surfaces. And if you are experiencing symptoms, please call the Tarrant County Coronavirus Hotline at 817-248-6299. This is what I'm talking about fighting. We have got to put this on the forefront of our minds so that we can fight an unseen enemy here in this virus. And finally, I want to ask one more time for everyone in Arlington and Texas to come together. Our churches have announced a citywide call to prayer online at 6 p.m. today. And I want to say thank you to everyone in our faith-based community. No matter the denomination, people have been coming together. And we really appreciate keeping the faith during these difficult times. Our seniors and people with chronic medical conditions are most at risk when it comes to COVID-19. Let's take care of our neighbors. Let's call up loved ones and talk to people who are more vulnerable to the virus and who might feel isolated. But let's use the phone or Skype. Listen to their concerns and be there for them. Pray with them and let them know they're not alone. One of the things I'm proud of as your mayor here in Arlington is how kind and generous our citizens are. I see it every day, and I see how strong you are. We all need to stick together and answer the call. We're going to get through this. And Governor Abbott, Judge Whitley, thank you both again for your support to our residents and your leadership. And thank you for doing everything you can to make our community safe. And thank you for what you're doing today.
Thank you, Mayor. Doctor, did you want to say anything?
Yes. Hi, I'm John Hellerstedt. I'm the Commissioner of the Texas Department of State Health Services. You've heard some incredible wisdom from your very, very well-informed leaders, from the governor to your county judge to your mayor. Mayor, you did an outstanding job of telling the public what is important in terms of public health and how to prevent this. I want to assure folks that between the national level at the CDC and the state level, but most especially here in Tarrant County and in Arlington, you have outstanding public health professionals, and they're on it, they're working on it, and you are very well protected as a result of their expertise and activities. And so I think it's amazing the messages that we're hearing here. Every one of them is true. You can see that your leaders are very well informed, and they're making wise decisions that are soundly based on the truth and the facts of public health. So with that kind of unity and that kind of strength, we are going to face this challenge successfully.
Thank you, Doctor. Nim?
Thank you, Governor. While this virus may be novel or new, the way that we respond to it in this city, this community, this state are not. It's the same time-tested policies, people, and procedures that we've responded to every natural disaster that our state has faced. Our relationships are important, our communication is important, and I ask that when you see the first responders or the healthcare workers out there, tell them thank you, keep them in your prayers, and we're going to be in this for a while, and we need your support supporting them.
Thank you. Let me give you some updated facts, and then we'll open up for some questions. The information that I'm provided before I came out here is that there are now 83 confirmed COVID-19 cases identified across 23 counties in Texas. There are now 3 deaths, and there are currently more than 1,900 people who are being monitored for the possibility of having COVID-19. Our testing capabilities have increased dramatically. We are receiving test kits as we speak. And by the end of this week, we will have the capability of administering 15 to 20,000 tests per week. And let me emphasize that as we see the increase and spread of this across the state of Texas, it is absolutely essential that every leader, whether it be city, county, whatever type of jurisdiction, every leader must employ the standards that have been established by the CDC to mitigate the spread of the coronavirus. With that, we'll take a few questions.
Governor Abbott, have you considered the possibilities of shutting down bars and restricting restaurants statewide? I mean, you look at an area like Collin County, you've got 3 different municipalities doing 3 different things.
Yes, I have considered that. I will be making an announcement about that tomorrow. Let me put this in some level of context, and that is, we have worked very collaboratively at the state level, along with local officials. It could be county judges, could be mayors, as well as local healthcare authorities since early January. This has been a collaborative effort in the tradition about the way Texas responds to disasters, and it's been handled quite well at all levels. That said, it's clear that we've seen an increase. When I made my disaster declaration on Friday, since that time and today, the number of people who have tested positive have more than doubled. On the day I made my disaster declaration, there were 0 deaths. Now there are 3. Since I declared my disaster declaration, the number of counties impacted have more than doubled. It is clear that this spread is occurring across the entire state of Texas. Traditionally, the way disaster response works is a governor will issue a disaster declaration, and that empowers local jurisdictions, whether they be county judges or mayors, for them to be in charge of running emergency operations for their communities, because they know better their communities than anybody else does. We're dealing with something, however, that is not just statewide in scope, not just nationwide in scope, but is worldwide in scope. And I will be providing an announcement tomorrow that addresses all of this. But I do want to have the opportunity to get input from local elected officials today. And so I'm telling every local elected official in the state of Texas today, we need to hear from you today about your needs, your strategies, your thoughts, and your input that will shape what I announce tomorrow.
I want to thank the governor very much for asking for that input earlier today. And again, as I said earlier, we will have a press conference at 2, and the draft that we started talking about yesterday will do just kind of what you talked about, and I believe it will recommend the closure of bars, gyms, those folks, those types of folks.
Governor, I believe you had a conference call with healthcare CEOs yesterday.
Yes.
In the event of a surge in patients, how many patients can Texas hospitals handle at one time?
Okay, so
Assuming that your healthcare
sure.
officials are healthy.
So I wanted to find out the capacity that hospitals have to be able to respond to COVID-19. And so I convened a conference call of all the leading CEOs of all the hospital systems across the entire state of Texas, including those here in the Dallas-Fort Worth area. And we learned a lot of things, including the capacities that they currently have, whether it be with regard to beds, whether it be with regard to ventilators, whether it be with regard to staffing, which is very important because staff can contract COVID-19 also. And so we left there with some top-line ideas that we're going to follow up on. The main thing I wanted to be able to address and have nailed down this week is the number of beds that will be available. We've seen in situations, whether it be in other states or other countries, about pressing needs for beds. First, I will tell you that I was impressed with the number of beds that already exist, as well as the additional secondary strategies that hospitals already had in place, including such things as medical tents that already exist. They can be propped up in a one-day time period. But it led us to certain additional strategies, such as acquiring additional medical tents to make sure that we will have full capacity. The second item that was mentioned that would be effective, because I was asking them for their input. They said that they could quickly upstand recently closed hospitals, medical centers, quick clinics, these standalone ERs, things like that are fully equipped to handle something like this. That could be turned around very quickly. In addition, there are other, if you would, pop-up temporary facilities that could be located at hospitals. And then I inquired about something that we already have in our inventory, and that is standalone empty motels or hotels. They are very useful for single-person bedrooms that have a bathroom in it, for people who have tested positive with COVID-19 but are not in critical care condition. We need the hospitals to be available to take care of everybody who has a critical care need, but we also need other facilities available for people who tested positive for COVID-19 who need isolation. And so when you aggregate all of this together, we see and believe that we have plentiful supply of resources at different care needs that will be able to address what could be a significant increase in the number of people who are both testing positive for COVID-19, those who have minimal consequences of it, and those who have critical consequences from it.
Do you have a number?
We didn't come up with a raw number simply because there are easy example. We have a whole lot of hotel facilities offered to us, and we haven't added up all the bed numbers. I didn't do the multiplying factor of all these emergency medical tents that could be set up immediately, and we didn't do the math of adding it all up. But what the conclusion was, we have a plentiful supply to address the needs that we believe that we will be facing in Texas.
Governor, I spoke with the James family this morning, and I asked them if they had any questions they wanted me to ask you.
Sure.
And what they said, they're very upset that they could not get an expedited test on Mr. James. They want to know, are you going to make changes and ensure that there's expedited testing for elderly people such as he was, who show symptoms of COVID-19 but have not traveled internationally?
Sure. Very important, because what you're asking is a medical question, and so I think it's always best for medical questions to be answered by doctors. We have the chief doctor who's in charge of this for the state of Texas with us right here, and that is Dr. Hellerstedt. So it's important that he be able to answer that medical question.
Okay.
Very good. So we are expanding our testing capacity, and right now, for instance, I'm most familiar with the public health testing system. And it is really pretty much up to date, if you will, in terms of being able to receive a test and have a timely turnaround. And what we're making sure that we have is the understanding out there of who qualifies for testing. So for one thing, it's still important that the person has symptoms. We simply can't test people who don't have symptoms. It's not a good use of that resource, no matter how plentiful that resource would be. And I could give you reasons why that's the case medically, but basically we're looking for people who have symptoms. Right now then, we combine, do they have symptoms and do they have some risk factor? And that risk factor could be travel, as it has been in the past. That risk factor could be exposure to a known case. But also we've expanded that, and the CDC has expanded it to seriously ill persons in a hospital who don't have a known cause for the illness. We hope also to additionally expand that more broadly to populations, if you will, that are at risk, such as people who are elderly or have serious underlying medical conditions. But all of that is a function of our capacity and our ability to get the necessary things that we need. You're seeing an example of the collection kit swabs. We're very relieved to see that we now have an increase in that availability. And then likewise in the public health system, we're doing everything we can to expand that testing capacity. I'm happy to say it works well, and we have short turnaround times. And then what we hope is coming online very soon is a massive increase in testing capacity based on private laboratories that will be able to do literally thousands of tests a week. So that's where the testing capacity and criteria are at this moment.
Let me come back and answer your question from what I heard from your question. And I'm not going to talk as a doctor. I'm going to tell you what I have learned from practical experience from people that I have known who have taken the test. What I heard was the timing of getting it back.
Right, it was sent to an outside lab.
Right, and so the experience that of people that I have known They were hoping they would get the results in 24 hours. They're told 24 to 48 hours. Everyone that I have known who has taken the test is taking at least 48 hours to get the test results back.
Jack Fig. Governor, thank you. Do you have a list of other supplies that the hospitals told you they need as far as ventilators, things like that? What is the state doing to make sure that there are enough? And does the state have any projections as far as how many people may need to be hospitalized, how many people may, be at risk of getting?
Sure. Understand several things. First, if you contract COVID-19, most of those people do not need to be hospitalized. I'm going to just tell you, not my advice, but the advice that's been provided to me both by doctors as well as the hospital officials that I talked to, and that is the appropriate treatment regimen or strategy for someone who's been diagnosed with COVID-19 is isolation at their home. And the only reason why you would not do that isolation at home would be if being at home would cause you to expose yourself to, let's say, a lot of other family members or a whole lot of people who may be coming in, which would be a reason why maybe a hotel room would be a workable solution if other standards were established. So the large majority of the people who will test positive for COVID-19 are not going to need access to things like ventilators or respirators or things like that. With regard to our availability of those resources, in the information that I received from the hospital officials, they felt satisfied with the number, but we always have a need for more. I have been in conversations with federal officials at the highest level to make sure that Texas will be receiving more ventilators and respirators as well as other equipment that is needed for those patients who do categorize as critical care patients.
Governor, I would like to ask you a question, sir, to please speak to the fear, particularly in the immigrant community throughout the state. Some folks may be scared that maybe they are sick, maybe they do have these symptoms, but they're scared to come forward to get tested because they don't know what is going to be asked of them. So maybe they're continuing to work. Maybe that would then obviously make it worse when it comes to the spread. So I'd like to get your message to the immigrant community, please, sir. And also, I would like to know if ICE is continuing to do their jobs as far as detaining criminal undocumented people.
Sure. First, the message is actually exactly the same to the immigrant community as well as the non-immigrant community, because the questions that are asked are the same. They're all medical questions. And Dr. Helderstedt went over them. I'll repeat basically the questions a person's going to be asked. And that is, what are your symptoms? And they will seek to determine whether or not somebody has symptoms that are consistent with COVID-19. If they don't, they're not going to be getting a test. If they do have symptoms, then several other medical related questions will be asked of them to assess whether or not they would be getting a COVID-19 test. The test would be, right now the standard is basically based upon a prescription by a doctor that would qualify the person for a test. And so there's no other different types of background questions that are being asked. As far as what ICE is doing, you'll have to talk to the federal government and ask ICE about that.
What is your message, sir, to people in the immigrant community?
Well, it's just that, again, the message is the same to everybody. We want everybody who needs to be tested to get tested. You should have no fear about that whatsoever. If you think that you may have COVID-19, we want you to go through the process of trying to get tested. I will add something else that also is very important, and that is not everybody may have healthcare insurance. COVID tests are being provided for free. Cost is not an obstacle to being able to get a COVID-19 test. If you don't know where to go for the test, contact your local healthcare authority, which is the governmental authority, the Tarrant County Local Healthcare Authority if you're in Tarrant County, and they can tell you where, when, and how you can get a test. Sometimes it's at the local healthcare authority. If not, you can call 211, and 211 can provide information about where your local healthcare authority is, where testing can be done, and then in addition to that, low cost or no cost COVID-19 test that could be provided.
Thanks, guys. We got to run. Appreciate it.